Howdy everyone, Madam Mateo here, coming at you with another orthopedic special test, and this one is for the thoracic spine. It is the lumbar-locked rotation test.
That's that, and then it'll fly up in just a second. See? And then, no!
This came from a commentary paper in 2010 by Dr. Katherine Johnson and Dr. Terry Grindstaff. And they were talking about a way to assess thoracic rotation. And they described this as a way to assess it by taking out the hips, pelvis, and lumbar spine. And this is just based upon other things of ways to kind of bias the thoracic spine to assess mobility. So to perform this test, you're going to have them in this kneeling position, like a prayer position, so that their hips are flexed and they're sitting back on their heels, resting up on the forearm. You will need an inclinometer. And then all you do is that you ask them to put one arm behind their head. Mateo will do that here. Place the inclinometer about T1, T2, and have them rotate towards that side that they have up. So once they reach the end range, you get the measurement on there, and then you compare that to the other side, and you have your measurement. In getting into the research for this test, it has been found to be very reliable. Both inter and intra-rater reliability has been found to be very good, and they've looked at different groups of individuals. So they looked at people with normal, healthy adults, they've looked at people with low back pain, they've looked at people with hypermobility, they've looked at swimmers, they've looked at people with neck pain, and they found with all these groups that it is a reliable test. They even had a paper where they compared this test to MRI findings and found that it did correlate with one another, although they did say that there are some like errors and stuff that go on. But again, overall, that it has been shown to be a reliable test. So there is the lumbar-locked rotation test. So let us know, what do you think about it? Do you assess thoracic rotation in this manner, or maybe you will? Let us know down in the comments. And like always, take care of yourself, take care of your patients. We'll see you then.